Look, we are tackling a heavy topic today, but we are going to completely flip the script. We're transforming the terrifying reputation of pancreatic cancer into an empowering, strictly actionable health checklist. You know how this cancer is notorious for being caught way too late, right? Usually after it's already spread? Well, by understanding the very specific signals your body sends, you can absolutely take control of your health.
Let's just debunk a massive myth right off the bat. This cancer actually whispers long before it shouts, and if you know how to listen, early detection can dramatically improve survival rates. It's stealthy, for sure, but no, it's not completely silent. Our whole goal today is to teach you how to hear those whispers. Now, having one or more of these symptoms doesn't automatically mean you have cancer, but recognizing them and actually consulting a physician promptly, that could literally save your life.
So to make this super easy to follow, we've broken these subtle signs down into a 6-part checklist. We'll cover the silent cancer myth, digestive and stool red flags, pain and visible warnings, hidden systemic alarms, the clinical examination, and finally, your exact medical action plan. Let's get right into it.
Okay, Zone 1, digestive and stool red flags. Now, what's totally fascinating and absolutely crucial to understand is that according to a major Danish registry study, gastrointestinal complaints often show up in medical records a full 6 to 12 months before a formal diagnosis. Think about that timeline. When a tumor grows, it fundamentally wrecks how you digest food. It can literally physically compress the outlet of your stomach, which leaves you with persistent indigestion and nausea simply because the food is just sitting there. Then there's early satiety, feeling uncomfortably full after taking just a few bites. Why? Because the tumor actually messes with the hormones that regulate your appetite, effectively turning off your natural hunger signals.
And then we get to the visible stool changes, defined by a critical medical term you really need to know, steatorrhea. It happens because a pancreatic tumor blocks a key fat-digesting enzyme called lipase from ever reaching your intestines. Because the fat isn't being digested, it ends up right in your stool. This makes it look pale, incredibly greasy, or oily. These stools often float, and because your intestinal bacteria go crazy fermenting those undigested fats, they have a distinctively foul odor.
So, the absolutely crucial point here is time. Digestive issues are super common, so we tend to just brush them off, right? Well, 2 weeks is your benchmark. Any persistent change in stool consistency, a profound loss of appetite, or unrelenting indigestion that lasts more than 2 weeks is your strict trigger to see a doctor. Do not just let it drag on for months.
Moving on to Zone 2, pain and visible warnings. Let's decode those physical clues.
You really have to know the difference between everyday aging aches and something far more sinister. This comparison is a real game changer. Normal mechanical back pain usually gets a bit better when you rest or do some physical therapy, right? Pancreatic back pain is a whole different animal. It happens because a tumor is actively invading a major nerve bundle called the celiac plexus. This creates a deep, gnawing, just constant ache right between your shoulder blades. And here is the major red flag to watch out for. It often feels significantly worse when you lie completely flat on your back. That's because gravity is allowing the tumor to press directly against your spine and nerves.
Along with the pain, we need to look for visual changes. Roughly 50% of pancreatic cancer patients develop jaundice at some point. See, when a tumor blocks the bile duct, a yellowish pigment called bilirubin backs up straight into your bloodstream. And this triggers a very specific cascade of symptoms. Your skin and the whites of your eyes turn yellow, your urine turns the color of dark tea, and your stools become clay-colored. But pay super close attention to this one intense symptom: severe skin itching, medically known as pruritus. It's caused by bile salts depositing right under your skin, and it's often so maddening it ruins your sleep. Plus, it frequently shows up before you even start looking yellow.
Now, this next one is surprising, but it's a critical warning sign. It's called Trousseau's syndrome, named after a physician who documented it way back in 1865. Basically, pancreatic cancer cells release high levels of substances that cause your blood to clot excessively. If you suddenly develop deep vein thrombosis, like a swollen, painful hot blood clot in your leg, and you don't have any obvious risk factors like a recent surgery or a super long flight, it absolutely warrants a thorough investigation for an underlying malignancy.
All right, into Zone 3, hidden systemic alarms. This is all about monitoring those internal body shifts.
Unintentionally losing 10 pounds, or about 5 to 10% of your body weight, is a massive red flag. We're not talking about a new diet working well here. This rapid weight loss is driven by a scary phenomenon called cancer cachexia. These cancer cells are metabolically aggressive. They literally consume enormous amounts of your body's glucose and nutrients. Combined with the lack of digestive enzymes we talked about earlier, your body effectively begins starving itself, breaking down your muscle and fat stores just to fuel the growing tumor.
And contrast your everyday run-of-the-mill exhaustion with this. Normal tiredness? It gets better after a solid night's sleep. Cancer-related fatigue is an overwhelming energy crisis that penetrates straight to your bones. It's driven by microscopic bleeding that causes anemia, poor nutrition, and all those inflammatory cytokines we just mentioned. You could sleep for 10 straight hours and wake up feeling completely drained and breathless. It simply won't improve with rest.
Okay, this number is incredibly critical, especially if you're taking notes for your health checklist. Researchers estimate that up to 1% of people diagnosed with sudden-onset diabetes after age 50 will actually develop pancreatic cancer within 3 years. That's a huge link. The Pancreatic Cancer Action Network is currently investigating this exact connection to develop early screening protocols.
So unlike typical type 2 diabetes, which usually builds up over years of insulin resistance, cancer-induced diabetes hits suddenly. A tumor physically damages the insulin-producing beta cells in your pancreas, or it secretes peptides that wreck your insulin function, causing a rapid spike in blood sugar. Listen, if you are over 50 and suddenly develop diabetes, especially, and I mean especially, if you have zero family history and you aren't obese, you absolutely must advocate for pancreatic screening.
Next up, Zone 4, the clinical examination. Let's talk about what happens when you actually get to the doctor's office.
By the time you're sitting on the exam table describing your symptoms, your physician will start systematically pressing across your abdomen. But what exactly are they trying to feel in there? Well, they're looking for physical evidence, which, unfortunately, usually indicates advanced disease.
Your doctor might feel for something called the Courvoisier sign. Remember how we discussed jaundice a minute ago? If a tumor in the head of the pancreas blocks the common bile duct, the bile has nowhere to go. It backs up and balloons the gallbladder. A doctor can actually feel this smooth, rounded, enlarged mass right below your rib cage when you take a deep breath.
They'll also check for hepatomegaly, which is just the medical term for an enlarged liver. Because the pancreas drains its blood directly into the portal vein of the liver is absolutely the most common site for this cancer to spread to. If the doctor feels a firm, irregular edge extending below your right rib cage, well, it's a very serious finding that demands immediate attention.
But remember, and this might be the most vital takeaway of this entire section, physical detection alone is just not enough. The pancreas sits super deep in your abdomen. By the time a mass is palpable from the outside, the cancer has usually grown substantially. In fact, only about 20% of these cancers are resectable, meaning they can be removed by surgery at the time of diagnosis. That is exactly why firmly pushing for sensitive modern imaging like a CT scan, an MRI, or an endoscopic ultrasound is non-negotiable.
And finally, Zone 5, your medical action plan. This is your exact playbook.
Okay, here are the steps. Step 1. Track the time. If your indigestion or stool changes last unbroken for over 2 weeks, make the appointment immediately. Step 2. Don't just walk in and say, "I feel sick." Be highly specific. Tell your doctor if your back pain specifically worsens when lying down, or if your diabetes came on suddenly at age 55 without any weight gain. Step 3. Firmly request comprehensive evaluation and imaging. Please do not settle for just antacids or physical therapy if your gut is telling you something is systemically wrong.
Look, our whole goal here is to empower you with awareness, not panic. While these symptoms definitely overlap with a ton of common, non-cancerous conditions, catching these whispers early, way before they become a palpable mass or spread to the liver, gives you the absolute best possible advantage. Early detection opens the door to life-saving surgical options.
We've covered a ton of ground today, from floating stools to sudden diabetes. I highly encourage you to share this vital health checklist with your loved ones, especially anyone over the age of 50. And I want to leave you with this final, crucial thought to ask yourself today. Are you truly listening to what your body is trying to tell you?